Italian prosecutors are considering criminal trials for health officials after grieving relatives of coronavirus victims demanded justice for their negligence. Italian prosecutors are considering criminal trials for health officials after grieving relatives of coronavirus victims demanded justice for their negligence. More than 45,000 people have joined Noi Denunceremo, meaning we will report, which is a Facebook group where testimonies are being gathered for magistrates. The group was created by Luca Fusco, whose father died from coronavirus in Bergamo, in the Lombardy region of Italy, which has been worst hit by the virus. The country's total death toll now stands at 25,085, the second highest in the world after that of the United States. The Facebook page reads, "This group was born out of a need for justice and truth to give peace to our dead who could not even have a decent burial following the coronavirus pandemic. When everything is over, whoever made a mistake and turned his head to the other side will have to pay. We will denounce and ask for justice." The testimonies being shared share similarities such as the virus being mistaken for ordinary flu and people at home suffering from a fever advised to take paracetamol. The aim of the group is not to target health workers, but people in leadership positions who may have underestimated the virus, Fusco told The Guardian. The health workers are victims as much as those who have died, he said. But as the healthcare system in Italy is decentralized, it would have been those who lead the regions who set the guidelines for hospitals. So if a magistrate decides there is a case, then the responsibility would be at regional level. An official investigation at one hospital in Alzano Lombardo in Bergamo has already begun, where coronavirus symptoms were not recognized and the disease spread through the hospital and beyond. Prosecutors in Lombardy are also investigating possible crimes of negligence and manslaughter following hundreds of deaths in care homes. Legal action is also being planned in regards to the 144 healthcare workers who have died as a result of the virus, mostly due to lack of protective equipment available at the start of the crisis, according to doctors' associations and unions. Robert Lingard, an Italian who lives in London, has filed legal action with a prosecutor after 2 of his relatives died and 3 others were in intensive care. The prosecutor will help establish weather campaigns in Milan and Bergamo encouraging people to carry on as normal, such as going to bars and restaurants or shopping, during the early stage of the outbreak constitute criminal negligence. He said that public authorities were aware of the aggressiveness of the virus due to data coming out of China and that large-scale containment would be necessary, but nonetheless seemed to act in denial. Elena Gazzola, a lawyer in Codogno, the Lombardy town where Italy's outbreak emerged, said the challenge was establishing who should take responsibility. She expects a lot of legal action to be taken by various groups once the emergency is over. Lawyers are studying the issue and collecting documents to see if there could be eventual judicial processes or compensation for damages, said Gazzola, who has so far been contacted by 5 people who have lost loved ones. There are many aspects to consider.